Morphine is a powerful opioid analgesic used primarily to treat severe pain. It works by binding to specific receptors in the brain and spinal cord, which helps to block the perception of pain. It is often prescribed for patients recovering from surgery, those with cancer, or individuals with chronic pain conditions. While effective, morphine also carries a risk of addiction, misuse, and various side effects, such as drowsiness, constipation, nausea, and respiratory depression. It is important to use morphine only under medical supervision and as prescribed. If you have specific questions about opioids are a class of drugs that include both prescription medications and illegal substances. They are primarily used to manage pain, particularly moderate to severe pain. Opioids work by binding to opioid receptors in the brain and spinal cord, which helps to block pain signals and produce feelings of euphoria, relaxation, and well-being. There are two main types of opioids. 1. Natural opioids. These are derived from the opium poppy, such as morphine and codeine. 2. Synthetic opioids. These are man-made and include medications like oxycodone, hydrocodone, fentanyl, and methadone. While opioids can be effective for pain relief, they also have a high potential for misuse and addiction. Overuse can lead to tolerance, needing more of the drug to achieve the same effect, dependence, experiencing withdrawal symptoms without the drug, and overdose, which can be fatal. Due to the opioid crisis in many countries, there has been increased scrutiny and regulation around their prescription and use. It's essential for patients to use these medications under the guidance of a healthcare provider and to discuss any concerns about risks and alternatives. If you relate terms in the context of pain management and opium is a natural derived from the latex Opioids and opium are related but distinct terms in the context of pain management and substance use. Opium. Source. Opium is a natural substance derived from the latex of the opium poppy, Papaver somniferum. It has been used for centuries for its analgesic and sedative properties. Components. Opium contains several alkaloids, including morphine and codeine, which are the primary active compounds responsible for its pain-relieving effects. Usage. Historically, opium has been used in various forms, including as a raw product, in tinctures, or as part of traditional medicine. It can also be smoked or ingested. Opioids. Definition. Opioids refer to a broader class of drugs that include both natural opiates, like morphine and codeine derived from opium, and synthetic or semisynthetic drugs, like oxycodone, hydrocodone, and fentanyl. Mechanism. Opioids work by binding to specific opioid receptors in the brain and body to reduce the perception of pain and produce feelings of euphoria. Medical use. Opioids are commonly prescribed for pain management in various medical contexts, including post-surgery, cancer treatment, and chronic pain conditions. Key differences. Origin. Opium is a natural product from the opium poppy, while opioids include both natural and synthetic substances. Composition. Opium contains several active ingredients, whereas opioids can be single compounds or combinations created in laboratories. Usage. Opium has historical significance and traditional uses, while opioids are primarily used in modern medicine for pain management. Both opium and opioids carry risks of addiction and misuse, and it's essential to use them responsibly under medical supervision. If you have more specific questions, analgesic is a type of medication that is used to relieve pain. Analgesics can be classified into several categories depending on their source and mechanism of action. Here are the main types. 1. Non-opioid analgesics. Examples: acetaminophen, Tylenol, and non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, and naproxen, Aleve. Mechanism: these drugs work by reducing inflammation or blocking pain signals in the brain. They are often used for mild to moderate pain, such as headaches, muscle aches, and arthritis. Chart 2. Opioid analgesics. Examples: morphine, oxycodone, hydrocodone, and fentanyl. Mechanism: opioids bind to specific receptors in the brain and spinal cord to block the perception of pain. They are typically prescribed for moderate to severe pain, such as that experienced after surgery or due to cancer. 3. Adjuvant analgesics. Examples: antidepressants, like amitriptyline, and anticonvulsants, like gabapentin. Mechanism: these medications are often used in conjunction with other pain relievers to enhance pain control, especially for neuropathic pain or chronic pain conditions. Uses of analgesics. Analgesics are used to treat various types of pain, including acute pain, short-term pain, chronic pain, long-term pain, and pain associated with specific conditions like arthritis, fibromyalgia, or post-operative recovery. Side effects and considerations. Non-opioid analgesics can cause side effects like gastrointestinal issues, while opioids have a higher risk of addiction, dependence, and overdose. It's essential to use analgesics under the guidance of a healthcare professional to ensure safety and effectiveness. If you have specific questions about a particular analgesic or need information about its use, side effects, or interactions, feel free to ask. Oxycodone, opioids, and oxycodone, opioids, and steroids are distinct categories of medications, each with different uses, mechanisms, and effects. Here's a breakdown of each. Oxycodone. Type: oxycodone is a specific opioid analgesic. Use: it is prescribed to manage moderate to severe pain, often after surgery or for chronic pain conditions. Mechanism: oxycodone works by binding to opioid receptors in the brain and spinal cord, blocking pain signals and producing pain relief. Available in immediate release and extended release formulations. Risks: like other opioids, oxycodone has a potential for misuse, addiction, and side effects such as drowsiness, constipation, and respiratory depression. Opioids type. Opioids are a broader class of drugs that include natural, semi-synthetic, and synthetic substances. Examples: this class includes morphine, oxycodone, hydrocodone, fentanyl, and codeine. Use: opioids are primarily used for pain management, ranging from mild to severe pain. Mechanism: they act on the central nervous system to block pain perception and can also produce feelings of euphoria. Risks: opioids carry risks of addiction, tolerance, dependence, and overdose. Steroids type. Steroids, particularly corticosteroids, are anti-inflammatory medications that are different from opioids. Examples: prednisone, cortisone, and dexamethasone. Use: steroids are used to reduce inflammation and suppress the immune system. They are often prescribed for conditions such as asthma, arthritis, and autoimmune diseases. Mechanism: they work by mimicking the effects of hormones produced by the adrenal glands, reducing inflammation and immune responses. Risks: long-term use of steroids can lead to side effects like weight gain, osteoporosis, diabetes, and increased risk of infections. Summary: oxycodone is a specific type of opioid used for pain relief. Opioids encompass a range of pain-relieving medications, including oxycodone. Steroids are anti-inflammatory medications that serve different purposes, mainly focused on reducing inflammation rather than directly relieving pain. If you have more specific questions about any of these medications or their uses, feel free to ask.